Hi, my name is Swapnali Kulkarni, and today I would like to walk you through my project, which is translating cognitive behavioral therapy into VR interactions to treat anxiety symptoms in university students. This project is basically about CBT, which is a common psychological treatment given to patients who are dealing with anxiety, depression, or even other mental illnesses. And the crux of this project revolves around the core of CBT, which is correcting your negative thoughts. This is the glimpse of my VR prototype where it's a gamified experience where students wear VR headsets and try and put themselves into situations, and they can also see their thoughts where they can eliminate the negative thoughts and retain the positive ones. I would like to walk you through the concept. So it involves a virtual garden to maintain the human nature connection, very essential for therapy. And also there is an virtual therapist character, which is a 3D model called as Dr. Anna, who onboards the user and explains the task. There is also an animation which teaches the concept of CBT without any heavy medical terminologies and prepares the user for the task. So the interaction starts with reading the scenario on top, which is basically any common scenario in the life of a student. And then below, there are some automatic thoughts that might trigger based on that situation or that scenario. And users are supposed to use the virtual gun through the right hand touch controller. And the task involves identifying the negative thoughts, eliminating them, and retaining the positive thoughts. This entire interaction is also called as cognitive restructuring, which is the crux of CBT. I've heavily involved user experience elements here, like considering users' field of view, having the appropriate sizes to target, optimal level of legibility and readability, also involvement of auditory feedback because it has a gun, and also optimal level of a challenge because it's a game at the end. The outcome basically came out to be a very strong gamified therapy experience where people are very open to share their issues and develop a new perspectives and even develop positive mindsets. And the challenges also involved some participants had this hesitation because they prefer human intervention over uh, VR, and of course cyber sickness. Going forward, I would like to focus on anxiety specific scenarios, having a more narrowed approach. I would also like to include AR driven avatars for real time responses and also customization of weapons where users can choose their own experience and even surroundings. Performance feedback is another direction which we intentionally avoided because we didn't want to give any sensitive information out, and for which I would like to continue with my expert collaboration and try and enhance my concept further. Thank you so much for listening to me.